But I really want to speak for the next few minutes about the other two votes that will be taking place on the floor in a few moments. They're votes on what are called correcting resolutions. Now, let me explain this, because I think it might surprise some of the people to learn. We're not talking about the amount of dollars that are going to be appropriated in this current year's budget. These are restrictions as to how money can be spent. So it really deals with a philosophical agenda, not a budget agenda. This is not about reducing the deficit. This is about trying to impose a philosophical position on the budget for this year. So let me talk about the two correcting resolutions, and I'm going to urge my colleagues to vote against both. One would restrict funds going to Planned Parenthood, women's health care issues, which I call war on women. This deals with Title X funding. Now, Title X funding is used for preventive health services, cervical cancer screenings, breast cancer screenings, immunization, diabetes and hypertension testing, sexually transmitted disease testing and treatment, HIV testing, and referrals. Madam President, not one dime of the federal money can be used for abortions. That's the current law, the current prohibition. Currently, there are approximately 5 million people who benefit from Title X funding, over 4,500 clinics across the nation. 91% of the people who take advantage of these clinics have no health insurance. Less than 25% of Title X funds go to Planned Parenthood. And Planned Parenthood spends approximately 3% of its total budget on abortion services, not one dime of which is federal funds. Not one dime of which is federal funds. So this is not about abortion. This is about whether we're going to be able to provide preventive care to our most vulnerable in America. And it's an attack on women, because women are the basic beneficiaries of Title X funds. It's going to cost us more money through the use of emergency room services. It makes no sense at all. It's certainly counter to what we all say we want, and that's gender equity in health care in America. And I would urge my colleagues to vote no on that correcting resolution. The second correcting resolution is an attempt to repeal the Affordable Care Act that we celebrated its anniversary just a few weeks ago. Well, if you're a senior, you should be concerned about this vote, because now you have a wellness exam annually under Medicare that's reimbursed, so you can take care of your own health care needs. That would be put at jeopardy. If you are one of those 3.2 million Americans who fall within the so-called donut hole, the coverage gap for prescription drug coverage, you should be concerned about the repeal. You got $250 last year. You're going to get 50% of the cost of your brand name prescriptions covered, and by 2020, we're going to close the donut hole altogether. That would be eliminated if this continuing correcting resolution were to pass. If you're a senior, you should be pleased that at last we've been able to extend the solvency of the Medicare program by 12 years. And quite frankly, you should be worried about what efforts are being made here to privatize the Medicare system, making seniors pay more for their health care. It starts with this vote later today, where we can reject the efforts to turn back the clock on Medicare, where seniors would have to pay more. If you're a small business owner, you should be pleased by the tax credits that now are available, in which this correcting resolution would take away from you, making it more expensive for you to provide health care for your employees. If you're a consumer and you're now able to cover your child up to age 26, 1.2 million Americans, the correcting resolution would turn the clock back on the progress we've made in fighting the abusive practices of private insurance companies and dealing with pre-existing conditions. If you have a child with asthma, now you can get full coverage. If we turn the clock back by approving that continuing resolution, you'll be at the mercy of private insurance companies to provide you coverage, which very unlikely will happen. I could talk about emergency room visits and where some insurance companies require pre-authorization. I don't know how you get pre-authorization when you need to go to an emergency room. Well, we corrected that in the Affordable Care Act. Once again, the correcting resolution that are being asked to vote on will turn the clock back on that, putting you at the mercy of private insurance companies as to whether they'll cover your emergency room visit. And if you're a taxpayer, which is what we're talking about today with the budget, you should be very much concerned about this correcting resolution, because by turning back the clock on the Affordable Care Act, it costs the taxpayers over $1.5 trillion over the next 20 years. So it's counter to your need. But if you have pride, as I do, that America at long last has said that health care is a right, not a privilege, and recognizing we need to do more to improve our health care system, you want us to move forward and talk about the health care issues and try to improve our health care system. You don't want us to turn the clock back. The large number of people who have no health insurance or have restricted coverages because of the abusive practices of private insurance companies, or your inability to cover your children after they graduate from college, that's now been corrected. And we certainly don't believe that a correcting resolution would take that away from us.